Hey there, welcome back to my channel. If you're new here, I'm Tiana James. I am a full spectrum menstrual cycle awareness educator, as well as a holistic reproductive health coach. And through menstrual cycle charting is how I help women with difficult menstrual cycles restore balance to their reproductive health and finally heal from their debilitating symptoms. So my goal with this channel is to simply spread wellness knowledge and information that hopefully you can use as preventative care. And I want to be clear with the fact that I do not claim to be any kind of expert or any kind of doctor. I am actually a student. I'm constantly expanding my own knowledge in the areas of fertility awareness, menstrual cycle awareness, and holistic approaches to women's health. In fact, I'm currently completing my internship with Justice College International to become a certified holistic reproductive health practitioner. And I'm just here to share with you what I've been learning. You know, one of my favorite sayings is to chew up the meat and spit out the bones. So what that implies to here is take what you can use and then do your own research on anything that you hear from this channel. And with all of that being said, let's get into today's video. So I got my notes here, an outline of my notes. If you see me glancing over here, that's just me referring to my notes, making sure that I'm staying in line with what I want to share with you today. So my number one goal as a menstrual cycle awareness educator is to increase the awareness about the role of the menstrual cycle as being a unique reflection of a woman's overall physical health. So in this video, I'm going to be explaining how the menstrual cycle can serve as a fifth vital sign for women. To be even more specific, I'm talking about regular ovulation and true menstruation together is what has been coined as the fifth vital sign of a woman's lifelong health, because those are the two events that occur during a complete menstrual cycle that can help you determine if your reproductive health, if your cycles are within normal healthy parameters. So you may already be familiar with the four main vital signs that are routinely checked during doctor's visits by your healthcare providers or any medical professionals. And these vital signs are just measurements of the body's most basic functions. So we have the body temperature, the pulse rate, the respiration rate, that's your rate of breathing, and the blood pressure. These measurements are the first step in any kind of like medical setting, any kind of medical emergency, or during your medical evaluations. That's the first step that they check. And when your vital signs are measured consistently and regularly, your doctor is able to establish a baseline that is unique for you. So essentially, your doctor can use these measurements to notice any changes that might indicate some health issues or any kind of illness that might need some further investigation. So back to the menstrual cycle being the fifth vital sign and where that designation came from. In 2004, there was a conference held in New York, and it was titled "The Menstrual Cycle is a Fifth Vital Sign." And at the conference, there is a medical doctor. She's a professor of obstetrics and gynecology and pediatrics at the University of Cincinnati College of Medicine. Her name is Paula Hillard, and she quoted, this is her quote, "The menstrual cycle is not just a reproductive event, it's a window into the general health and well-being of a woman. If a woman is not having her period, it's the first sign that something else could be going on." Basically, a missing period is a symptom, and all symptoms are signs. Okay, that's what I like to tell people. The symptoms that you experience are signs. It's your body talking to you, and it's your responsibility to listen to her. A woman who's not ovulating and menstruating regularly and normally is going to experience some degree of compromised health. It's going to be cardiovascular health is compromised, um, neurological health, immunological health, even your endocrine health, especially, is compromised if there is not regular ovulation and menstruation occurring. When I talk about menstrual cycle awareness and charting, when you are monitoring your cycle, you kind of record what you experience every day on a chart. And when you learn to interpret what you see on those charts, you're able to have a window into the functioning of your endocrine system. So the endocrine system is the second most important system in the body, after the central nervous system being the first most important system of the body. So the central nervous system is the brain, the spinal cord, and the nerve cells. So that's pretty important, right? And the endocrine system is the second most important. So when the endocrine system is functioning poorly, all the other systems are going to suffer, especially the interconnection between the central nervous system and the endocrine system. So the endocrine system, it governs the menstrual cycle through its production of hormones. The menstrual cycle is very sensitive to systemic disorders, particularly endocrine disorders like hypothyroidism, Graves' disease, hyperinsulinism, syndrome X, which is insulin resistance, and PCOS. And if any of these conditions are present, it's going to show up in the menstrual cycle, and it's going to show up in the state of your fertility. On top of that, we have environmental stress, dietary stress, physical stress, psychological stress. All of that affects the menstrual cycle because stress elevates cortisol. Cortisol is the primary stress hormone. So stress elevates cortisol, and stress elevates insulin levels. And both of these hormones, cortisol and insulin, they have a suppressive effect on the reproductive hormone production, which is part of the endocrine system. So stress is one of those factors that really contribute to the development and the exacerbation of systemic disorders that affect the menstrual cycle, like in the case of women with PCOS. Stress really drives the severity of their PCOS symptoms. It's really important to remain mindful that our physiology is specifically designed for us to reproduce, no matter how distant the idea of pregnancy and motherhood may be to you. From nature's point of view, a woman isn't a viable reproductive unit if she is under stress. And nature has designed a way to downregulate a woman's reproductive capacity and cause temporary infertility until those stressors have been reduced. So in both sexes, male and female, infertility is like that warning signal that the endocrine system is not functioning optimally. And that's a physiological situation that has various long-term health consequences, but particularly so for women. If we are not good reproductive units, from nature's point of view, there's no reason for us to exist and continue to utilize Earth's valuable resources that could be better spent on humans who are contributing to the continuation of life. As our reproductive viability declines, our risk for degenerative diseases increases. So having menstrual cycle awareness and charting your unique patterns of your menstrual cycle will greatly enhance your ability to recognize your individual menstrual cycle patterns and ovulation, which can be used for reproductive planning, whether it's to avoid pregnancy or to achieve pregnancy. And so with having menstrual cycle awareness, it will empower you with the ability to identify endocrine disturbances, metabolic disturbances, any kind of like inflammatory diseases. You get that, like I said, that window and that reflection of your overall physical health. So when you use menstrual cycle awareness to chart your menstrual cycle events, such as the flow of your bleeding, any bleeding or spotting that is outside of true menstruation, it can be the presence or the absence of that fertile cervical mucus, the cervical changes that occur during the cycle, your basal body temperature shifts, mood changes, libido changes, food cravings, all of the events that are related to menstrual cycle rhythms. On your charts, it provides the critical information on the state of your reproductive health and your endocrine system. But the menstrual cycle is often overlooked as a fundamental sign of your overall health. And a lot of times, most women have a really negative attitude toward their menstrual cycle. And that negative attitude alone can contribute to the development and exacerbation of different symptoms and disorders and disruptions itself. So the best way to determine if your reproductive health is normal and it's good and it's healthy is by monitoring 6 specific events of the menstrual cycle, and you can monitor these events independently on your own. So let's get into them. So number 1, the first event to monitor is the menstrual phase. So the first day of your menstruation is the first day of your cycle. And the first day of menstruation should begin with a moderate to heavy flow. So if you're having any spotting before your flow begins, that is considered part of your last cycle, and that is called premenstrual spotting. So when we talk about PMS, those are one of the signs or symptoms is spotting. So your flow starts with a medium or moderate to heavy flow, and that moderate to heavy flow will require like maybe between 2 to 6 full pads throughout the day. And then your flow, you'll have like maybe 2 to 3 days of that moderate to heavy flow, and it should subside to a light and very light flow where you only need like 1 pad or panty liners throughout the day. And a menstrual phase should last between 3 to 7 days. In the studies, the average was 5 days. And throughout the entire menstrual phase, the total blood loss should be between 30 to 80 milliliters, or that converts to between 1 and 3 fluid ounces. So anything over the 80 milliliters or over the 3 fluid ounces is excessive. And you measure your flow through the amount of pads you use through the day, or if you use a menstrual cup, the menstrual cups have measurements on them, and you just kind of calculate how much of your blood filled the cup throughout the day. And that's how you can keep track of how much you're bleeding throughout your entire menstrual phase. Your bleeding menstrual blood will have an odor that's a little musky or metallic, but it should never smell foul or fishy. Shouldn't have the foul or fishy smell to your menstrual flow. And the color of your menstrual flow will change from a deep burgundy red to a bright red, pink, or brown as it starts to taper off. So that's the first event that you should monitor throughout your menstrual cycle. The second event that you should be monitoring is the number of days after menstruation before the onset of cervical mucus that accompanies ovulation. That was a mouthful. If you know anything about fertility awareness or menstrual cycle awareness, you will better understand what I mean. But after you menstruate, you'll have days that are what we call in the Justice world or any fertility awareness method as the dry days, right? So you have days where you're not experiencing anything that is on your tissue when you wipe, or in your panties. That's what we call the dry days. And these days can last between 0 to 15 days, but on average, it's about 6 days that are normally dry days. And these days are the infertile days, meaning there again is no cervical mucus present at your vulva or on the tissue when you wipe. So the third event is the days where cervical mucus that does accompany ovulation is present at your vulva or on your tissue when you wipe. And the average is about 4 days, but it ranges from 3 to 7 days. And these days will begin with a subtle change from those dry days to where you're starting to see like some dampness, some wetness, or some shininess, like I said, on your tissue when you wipe or in your panties. And then you'll have like 1 or several days of those damp, wet, or shininess. And then it will develop into what we call non-peak cervical mucus. You'll have 1 or several days of the non-peak cervical mucus. The mucus looks like, when you wipe on your tissue and you observe it, the mucus looks like, it'll be like a sticky, pasty, cloudy kind of mucus, and it'll develop over a few days. Will start to turn into more of a creamy, like hand lotion kind of mucus. And then 1 or several days of that will develop into what we call peak type cervical mucus. And peak type cervical mucus develops under the influence of peak estrogen levels. Peak type cervical mucus, you should have at least 1 day of peak type cervical mucus, but you may have like between 1 to 3 days of this peak type cervical mucus. Peak type cervical mucus is stretchy. It's very stretchy. If you finger test it, you can stretch it. It's clear and it has like a lubricative or slippery sensation to it, especially when you're wiping or when you're just walking around throughout the day. You kind of feel like juicy and wet. The peak type cervical mucus resembles raw egg white or like aloe vera gel. And then after those days of the mucus, that'll just dry up again, and it's followed by your typical post-ovulatory phase, which I'll get into what the post-ovulatory phase should look like. Although the menstrual cycle has technically 4 phases, which is the menstrual phase, the follicular phase, the ovulatory phase, and the post-ovulatory phase, it can be divided into 2 phases. And the 2 phases are the pre-ovulatory phase and the post-ovulatory phase. And ovulation is the dividing point between those 2 phases. So ovulation is when the egg is developing inside of a follicle, and as it matures, it will rupture from the ovary and picked up by the fallopian tubes, where it waits there to be fertilized by sperm. When ovulation does occur, that egg will only live for 12 to 24 hours if conception does not occur. If more than 1 egg ruptures from the ovary, it will happen within that same 12 to 24 hour period. Okay. And after that 12 to 24 hour time period, any further ovulations are impossible throughout the duration of that cycle. So ovulation is the 4th event to monitor for a healthy menstrual cycle. And so there are 2 ways to identify ovulation. One way to identify ovulation is by identifying peak day. So peak day is the last day that you experience any peak type cervical mucus. Again, if you're familiar with fertility awareness or menstrual cycle awareness, you know what peak day is. So peak type cervical mucus, again, is that clear mucus. It's stretchy, it's lubricative, it's slippery. And in the studies done, 100% of the time, ovulation occurred 2 days prior to peak day and up to 3 days after peak day. So that means that whenever you identify peak day, ovulation can occur 2 days before peak day, 1 day before peak day, on peak day, 1 day after peak day, 2 days after peak day, 3 days after peak day. If you are identifying ovulation by identifying peak day, you know that you have a 6-day window where ovulation can occur and where conception can occur naturally. And then the second way to identify ovulation, you can identify it retrospectively when you are monitoring your daily basal body temperature. And when you observe a shift, so like in the pre-ovulatory phase, you'll have a range of daily basal body temperatures that are, let's say, lower. You have a low pre-ovulatory range. And right after ovulation occurs, there's a shift to slightly higher ranges of your daily basal body temperature. So when you notice that shift in your temperatures, you know that the day before that shift is the day that you've ovulated. So when you are observing your daily basal body temperature, you're able to identify the exact day that you ovulate. But when you're identifying ovulation through identifying peak day, you just have that 6-day window that ovulation could have occurred. And if you're avoiding pregnancy, then you would avoid sperm from being in contact with the vulva and your vagina. All right. The fifth event to monitor for determining if your reproductive health is optimal is the post-ovulatory phase. So the post-ovulatory phase is the interval between ovulation and your next menstruation. So the number of days from peak day until the onset of your next menstruation usually averages about 13 to 14 days in length, and it ranges from 12 to 16 days in a healthy, normal menstrual cycle. So in a healthy, normal menstrual cycle, this post-ovulatory phase should remain stable from cycle to cycle. So that means that if you normally have, let's say, a 13-day post-ovulatory phase, then in every cycle, you should have 13-day post-ovulatory phase. So that means that when you identify peak day, you're able to count 13 days forward and predict that you will be coming on your next period. In another woman, if she usually has 15-day post-ovulatory phase, every cycle, if she has a normal healthy cycle, every cycle that post-ovulatory phase will be 15 days. So if you have a normal healthy cycle, you should have a constant or stable post-ovulatory phase. The exception for that is teens who've just started cycling and women who are in the perimenopausal stage. The expectation is irregular periods for teens who's just started cycling and perimenopausal women. So the post-ovulatory phase may not be stable or constant in every cycle, because for teens who are just starting their cycles are maturing. It is trying to get regulated. And the same for, kind of the opposite for perimenopausal stage women. Their cycles are starting to phase out. So it's going to be a little irregular in the perimenopausal stage when you're nearing menopause. And the post-ovulatory phase is primarily regulated by progesterone because the corpus luteum is producing progesterone. So I talked about the egg maturing inside of a follicle. So the follicle is a fluid-filled cyst. That means that the egg has this like follicle with fluid around it, and it develops and matures inside of the follicle. But when the egg ruptures from the ovary, it ruptures from that follicle, and that follicle remains behind, and it now becomes a temporary gland where it produces progesterone. And the corpus luteum will not live past 16 days if fertilization does not occur. And once the corpus luteum dies, the progesterone levels drop and the endometrium is no longer being supported. The endometrium is the uterine lining. So that is what sheds off during menstruation. So when the progesterone levels drop from the corpus luteum dying, is no longer supporting the endometrium, and so that's when it sheds off during menstruation. And the post-ovulatory phase is infertile. So that means that no ovulation is occurring during the post-ovulatory phase. I already mentioned that. And it's characterized by those dry days again. When you have those dry days, that's when you're infertile. That means there's an absence of cervical mucus at the vulva. And sperm cannot enter the cervix, and it can't enter the uterus without any fertile quality cervical mucus present. Now we're getting to the sixth and final event, which is the actual overall length of your cycle, which is the first day of menstruation until the last day before the next menstruation. Regular cycles have a normal variation in length of 8 to 10 days, and a cycle that varies in length from 8 to 10 days, which accompanies a period of stress. Think about like if you're traveling, especially by air, if you experience some kind of illness or some kind of crisis, it is normal to have a deviation in your regular cycle lengths of 8 to 10 days. So if you have let's say you have a textbook 28-day cycle, if you had a cycle that you've experienced some kind of stress, like I said, the travel, the illness, the crisis, it's normal to have a deviation of like, okay, maybe this cycle is 36 days. But then, after that stress period calms down, you go back to your regular cycles, which are like 28 days. But if you experience cycle lengths that have a variation greater to 10 days, and that variation is persistent over the course of like 12 cycles, that is what is considered irregular cycles. Okay, your variations in your cycles should not be greater than 10 days. So the combined length of the first 5 events, the menstrual phase, the days after menstruation, before the onset of cervical mucus that accompanies ovulation, the days where you experience cervical mucus that accompanies ovulation, ovulation itself, and the post-ovulatory phase. So the combined length of all of those events determines the length of your overall cycle. So your cycle does not need to be 28 days in length to be considered normal or healthy. That's just a textbook cycle, meaning that's the number of days that they always use when they are educating you on a reproductive cycle. A normal range in cycles is between 25 and 36 days. So a short cycle is being 25 days or less in duration, and then a long cycle is 36 days or longer. So if you're having cycles that are shorter than 25 days, then that may be an indication of some kind of disorder or disruption. And if you're having cycles that are longer than 36 days, that is also one of those early warning flags that your cycles are outside of the normal healthy parameters. So when all 6 of these events fall outside of the normal healthy parameters, on your charts, the imbalances, which are usually hormonal imbalances or physiological imbalances, it becomes very apparent on your charts. So if you're wondering, like, how do I effectively monitor all of these events? Like, how do I keep track of all of these events that I mentioned to understand if my cycle is normal or healthy? Well, that's where learning menstrual cycle awareness or fertility awareness comes into play. The Committee on Adolescence, that's the COA, and the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists, they've been widely encouraging the self-monitoring of the menstrual cycle starting at adolescence to identify and treat pathologies. Again, that's why the conference that I mentioned at the beginning of this video was held, to increase the awareness about the role of the menstrual cycle being a unique indicator of a woman's reproductive health and her overall physical health. So monitoring and charting your menstrual cycles using menstrual cycle awareness, a lot of times called fertility awareness, is very easy to learn, and it really becomes second nature once you learn how to record these events on your chart. And with menstrual cycle awareness and of course fertility awareness, you learn how to identify your fertile days and your infertile days so that you can avoid pregnancy with the same effectiveness as the pill, but without any of all those horrible side effects that come with the pill. The only side effect is the increased love for your body and its unique rhythmicity. I promise you, once you learn how to really pay attention to your body and listen to her, the love for your body, that if you have a negative attitude towards your menstrual cycle, that goes away, especially when you're able to see because usually when a woman has a negative attitude towards her menstrual cycle, it's probably because she's experiencing some kind of discomfort, some kind of debilitating symptoms that makes her hate her menstrual cycle. But when you're able to see the imbalances on your chart that are causing those symptoms or disruptions or disorders, then you're able to make a fully informed decision on what to do with your reproductive health, how you can go about treating it. When you understand the root of what you're experiencing, then you're able to go forward and treat your symptoms that you are experiencing. So that's why I really love using menstrual cycle awareness myself and charting my cycles. And I also just love teaching it to other women, because once their eyes are open to the power and the uniqueness of their bodies, and they understand their normal bodily processes and functions, you're better able to just love on yourself and treat yourself better. The self-care becomes a priority when you understand what needs to happen. I really hope that you enjoyed this video. If you did, you're going to love the programs that I offer. The first is my signature 12-week menstrual cycle awareness charting program, where I teach you how to observe and chart your own unique menstrual cycle patterns, and you can use those charts to manage and improve your reproductive health and your cycles using holistic practices. The second is my 12-week fertility awareness program, where I teach you how to observe and chart your fertility biomarkers, and you can use those charts to either avoid pregnancy naturally without the use of hormonal contraceptives, or you can use your charts to optimize your fertility and achieve pregnancy without any medical interventions. If any of these interest you, you can Click the link in the description box below to apply for those programs. Or if you just need to talk further about your unique situation, or you have any other questions or curiosities, you're very welcome to schedule a complimentary consultation with me. The link for that is included below in the description box also. Again, thanks so much for watching this video. If you liked it, don't forget to hit the thumbs up and subscribe. If you can't wait for my next YouTube video, make sure you're following me over on Instagram at starring.tiana. And with that, I'll see you over there and in my next video. Bye for now.